We'll take you to that briefing live now.
Okay, you'll find the same thing, and just in Gauteng alone, as we said. So, but we are saying that our constitution is very clear in terms of the right. I mean, the mandate of the state to provide health services for people who are in our country. We do accept the fact that our services are under pressure, and that if this demand for services from across our neighbors keeps on increasing, it will reach a stage where it is not sustainable. But we believe that it is not up to ordinary citizens of the country to think that they can deal with that to help the state. No, that is not the correct approach. There are many other challenges which we must deal with to improve the quality of service. We acknowledge that even without even the pressure of other neighbors, ourselves, we do have challenges. In terms of the allocation of funds, there's been reduction. We are not able to provide enough staff. They were telling me here in the various wards about the staff shortages, which is a matter which also with the DG, National DG here, who I've tasked to look at, even before we came here, to look at the issue of staff, because we are discussing with our colleagues in the National Treasury to look at further improvement in the staffing. We know that in many of our facilities, but I'm quite certain that, it's not my first time here, that the issue of poor management, I don't think is an issue at this hospital. I must credit the CEO and the team here. From the reports and even the staff morale, you can see that the hospital is properly managed. But in some of our facilities, there's also poor management. And in some areas, there's even maladministration. I'm sure, I don't need to tell you, there are reports which you have been reading about some of our facilities here in Gauteng and also in other provinces, where there is poor maladministration of the few resources at our disposal. In some cases, there are also cases of corruption which are being investigated. The President has already signed a proclamation for the SIU to investigate a number of health facilities. So we admit that there are those kind of challenges. So this issue of the additional pressure of high demand, including not only South Africans, but also our neighbors, it also adds on that. But we are saying, we're appealing to everybody to say, this is a matter which we are alive to. It has been discussed in a number of forums. I've even asked the DG to coordinate it with the heads of departments of all provinces so that we look at the magnitude and get advice properly as to how this can be dealt with. I can mention here that, as you will see from our statement, that from our governing party, the ANC, at our committees, there's also been suggestions, acknowledgement that the issue of pressure of additional need for services from neighbors does add additional pressure, and that we must find ways of how we can deal with it, including possibilities of contribution for some of these services by the governments of the neighboring countries, where they themselves acknowledge that certain services are not available. How do we make it orderly so that people don't have to, on their own, just cross the Limpopo, cross the borders and so on? Whether we could look at ways in which this can be properly organized, where the governments can sign agreements, whereby if there's need to be refunding and so on, there could be some compensation. But we want to appeal to the people from the Operation Dudula and any other local people and citizens that these issues, these challenges, the government which you have put in place is addressing that. Not just Ministry of Health, but working with the whole of government. We are seized with this issue. We are looking at its impact, its magnitude.
All right, and so we apologize for that break in transmission. Health Minister Dr Joe Phaahla briefing the media there, saying that it is not up to ordinary citizens to deal with immigration matters. The government is aware of the challenges that are faced by the health system, emphasizing that even if there were not people from other countries using the health system in South Africa, there would still be challenges, whether it's because of a capacity, whether it's because of poor management or other issues, saying that people should not take matters into their own hands. They are aware aware of those issues and they are dealing with them. And also emphasizing the fact that South Africa's constitution and South Africa's laws allow for people who are not South African to access emergency health system and access health systems that are here, and that it is legal to do so. And so we'll try and give you those visuals back a little bit later on, or summary of what's happening there.